My name is Andrea Philips and I am one of the counsellors at VARTA. Time to Tell is a video series to help you talk about how you became a family with the help of a donor. In this video, we will focus on how to tell adult children that they are donor conceived, including some practical examples. Regardless of what age you are telling your child, even adult children, there are a few things that you can do to make it easier. Number one, practice what you are going to say, including answers to questions that may come up. 2, focus on how you became a family rather than your fertility journey. 3, find words that you are comfortable using. 4, keep that conversation going. And 5, acknowledge your child's feelings, listen and be there to support them. If you are finding it difficult to start the conversation, ask for help from your support network or a counsellor. The more you put off trying to tell, the harder it may seem to do. Telling sooner rather than later is better, but try to avoid significant or emotional times such as birthdays, Mother's Day, Father's Day, or special events. Try and choose a time and place free from distractions and create a safe, comfortable environment where you can communicate with your child in person. Unless you live interstate or in another country, do not do it by email, over the phone or via Zoom. It's always best to try and do it in person if you can. Do consider who should be present. Will it be just parents and child? What about other siblings or your child's spouse, partner, or support person? And consider how this might impact on your wider family. You've made the decision to tell your child, so what are you actually going to say? It is important to remember that there is no wrong or right way to tell your child that they are donor conceived. Regardless of the age of your child, the message is the same. Your child is loved and wanted, and that you are, and you want them to be proud of how this family was made. Use the words that feel right for you. Think about the words that you are going to use. It can be helpful to explain that when they were conceived, fertility treatment was not very common. Anonymity was promoted and parents were encouraged not to talk about it and not to tell anyone, even you. Being told that you are donor conceived can come as a shock. Be prepared for your child to have a range of emotions. This could be anger, sadness, acceptance, or even a sense that the penny has dropped. It may now explain why they may not look the same as both of their parents or have somehow felt different. For you as a parent, it can also bring up feelings of buried grief. So do get the support you need. Over time and with support, knowing the truth can be positive for your family. There are going to be a lot of questions. Practice how you might respond to them. They may include questions about the family, details of who knows, questions about their donor or surrogate, why they weren't told sooner, and where or how they can find out more. The decision to tell others is a very personal one, and who you tell will depend on your situation. Telling your support network, family, friends and colleagues can help start conversations and allow them to better support you. It is important to think of the difference between privacy and secrecy. So do consider which people of importance are part of your child's life. And would this information be important for them to know? Each different state and territory in Australia has different systems regarding donor treatment. If the treatment occurred in Victoria through a registered ART provider, parents and donor-conceived children can apply for information about their donor from the VARTA Central Register. This information can be identifying or non-identifying information. Identifying information includes the person's name and date of birth, whereas non-identifying information includes the person's gender, ethnic background, and medical information. Children have an automatic right to know their donor's identity when they turn 18. However, they can apply for it earlier, and a VARTA counsellor will assess if they are sufficiently mature to understand the implications of knowing their donor's identity. Parents and donors can also apply for identifying information about their donor or donor offspring. However, the person they are applying for information about must first consent to their identity being released. If you are finding the conversations difficult, seek support early. Your support network of family and friends are a good starting point. You can find more information or additional support, including where to find a counsellor, on the VARTA website. The VARTA website has a range of resources available where you and your child can find out more information. These include personal stories of others who have been through the process of telling their adult child. We do hope you found this video useful.